I'd like to make 5 points about sexuality education. First is sexuality education is often seen as telling young people to put on condoms when they are not really ready to have sex. Sexuality education includes three things. One is it improves knowledge and understanding. Second is it is intended to build equitable norms and values, and to promote self-reflection and among adolescents. And thirdly, it aims to build social skills to refuse unwanted sex or to negotiate safe sex when needed. So it's a whole lot of things, and it really is not just about sex and reproduction. It really aims to prepare young people for a healthy sexual and reproductive life and a pleasurable sexual and reproductive life, and to prevent problems if and when, and to obtain care if and when these problems occur. The second point I'd like to make is there's convincing evidence from around the world that well designed and well delivered sexuality education programs result in good and do not cause harm. Well designed, well delivered sexuality education programs can improve knowledge and understanding, promote healthy behaviors, and when combined with a healthy dose of gender and discussion of gender and power, it has actually been shown to reduce health problems, unwanted pregnancies, sexually transmitted infections, HIV. The third point I'd like to make is that children and adolescents need sexuality education. They need sexuality education because they often don't know about their bodies, they don't know about puberty, they don't know about how to protect themselves and to avoid sexual and reproductive health problems. For instance, many adolescents in many parts of the world do not use contraception because they are really scared of its side effects. And if they have problems, they don't know where to go for help. Children and adolescents need sexuality education, and they have a right to sexuality education. And this is enshrined in the Convention on the Rights of the Child. Knowledge, information, and education for survival and for well-being. The fourth point, and the sad point, is that we're failing our children and adolescents. We're failing them at home, we're failing them at school, and we're failing them in our communities. Even today, in many parts of the world, high, middle, and low income countries, it's easier for a girl or a boy to access pornography with a few quick clicks of their mouse, rather than to be able to talk to an adult who cares for them, who's responsible for them, a parent, an elder sibling, an uncle, an aunt, a teacher, a health worker, about their bodies, about sex, about reproduction. And this stems from a deep-seated lack of willingness to accept that adolescents are sexual beings. And springing from that is this either denial of adolescent sexuality, refusing to accept adolescent sexuality, and when there is evidence that it's occurring, to wish it away. And so sexuality education is often seen, if it is seen as useful at all, it is seen as useful in telling young people not to have sex. I'm 60, and the sexuality education I had when I was a student of 13 in growing up in Bombay in India was on the sidelines of the school playground. I heard about it from a peer. And sadly, that's true still in so many parts of the world. The big difference is when I was growing up, we didn't have the internet, and we didn't have pornography being thrust at you from various sources. That's what we have to deal with today. It's not information which is corrupting young people, it's misinformation which is confusing young people, leaving them really worried about what's happening in their world. To end on a positive note, earlier this year, UNESCO led a group of UN agencies, including WHO, to publish an updated international technical guidance on sexuality education. updated from the 2009 version. This is a powerful document in that it provides evidence of the need for sexuality education, the effectiveness of sexuality education, and provides guidance on how it can be designed and applied even in the most conservative contexts. And it contains a whole section on points to make and arguments to use in addressing the concerns, questions, misinformation that decision makers, families, communities in many places have. And the very last point to make is that a small but growing number of countries are actually biting the bullet, if you like. They recognize that they need to provide sexuality education, and they're getting going with it. In the past, these was Northern European countries. Now you have countries around the world, countries such as Zambia, countries such as Colombia, countries such as Thailand. These are countries who are beginning to recognize that we cannot hide our heads in the sand anymore, and that in this crossroads we really have to acknowledge and that adolescents need sexuality education, and that we have to get going to deliver it to them. Thank you.